Menstruation is a natural phenomenon experienced by most women of reproductive age. It signifies the shedding of the uterine lining in the absence of pregnancy. However, for many women, menstrual cycles can be irregular, causing distress and discomfort. In this video, we will delve into the various causes of menstrual irregularities and explore effective management strategies. Understanding menstrual irregularities. Normal menstrual cycle. The menstrual cycle typically lasts for 28 days, although variations are common. Phases of the menstrual cycle: follicular, ovulation, luteal, and menstrual phase. Hormonal fluctuations, particularly estrogen and progesterone, regulate the menstrual cycle. Types of menstrual irregularities. Amenorrhea. Absence of menstruation for 3 consecutive cycles. Oligomenorrhea. Infrequent menstrual periods, with cycles lasting more than 35 days. Menorrhagia. Heavy menstrual bleeding, often accompanied by clots. Dysmenorrhea. Painful menstruation, commonly associated with cramps. Causes of menstrual irregularities. A. Hormonal imbalance. Polycystic ovary syndrome, PCOS, characterized by hormonal imbalance and cysts on the ovaries. Thyroid disorders. Hypothyroidism or hyperthyroidism can disrupt the menstrual cycle. Pituitary disorders. Tumors or dysfunction of the pituitary gland can affect hormone production. Structural abnormalities. Uterine fibroids. Non-cancerous growths in the uterus that can cause heavy or prolonged periods. Endometriosis. The presence of endometrial tissue outside the uterus, leading to painful menstruation. Uterine polyps. Benign growths on the uterine lining that may cause irregular bleeding. Lifestyle factors. Stress. High levels of stress can disrupt hormone levels and affect the menstrual cycle. Poor nutrition. Inadequate intake of essential nutrients can lead to irregular periods. Excessive exercise. Intense physical activity can disrupt hormonal balance and menstrual regularity. Medical conditions. Diabetes. Poorly controlled diabetes can lead to menstrual irregularities. Obesity. Excess body weight can disrupt hormone production and menstrual cycles. Pelvic inflammatory disease, PID. Infections of the reproductive organs can cause irregular bleeding. Medications. Certain medications, such as hormonal contraceptives, anticoagulants, and antipsychotics, can affect menstrual patterns. Diagnosis of menstrual irregularities. Medical history. Understanding the patient's menstrual history, symptoms, and lifestyle factors. Physical examination. Examination of the pelvic area and assessment of secondary sexual characteristics. Laboratory tests. Blood tests to assess hormone levels, thyroid function, and other potential abnormalities. Imaging studies. Ultrasound, MRI, or CT scans to visualize the reproductive organs and detect any structural abnormalities. Endometrial biopsy. Sampling of the uterine lining to evaluate for abnormalities or signs of underlying conditions. Management of menstrual irregularities. A. Lifestyle modifications. Stress management. Incorporating relaxation techniques such as meditation, yoga, or deep breathing exercises. Balanced diet. Consuming a diet rich in fruits, vegetables, whole grains, and lean proteins to support hormonal balance. Regular exercise. Engaging in moderate physical activity can help regulate hormones and improve overall health. Medications. Hormonal therapy, birth control pills, hormone replacement therapy, or other medications to regulate hormone levels. Non-steroidal anti-inflammatory drugs, NSAIDs, over-the-counter medications such as ibuprofen or naproxen can help alleviate menstrual cramps. Antifibrinolytic agents. Medications like tranexamic acid can reduce heavy menstrual bleeding. Surgical interventions. Myomectomy. Surgical removal of uterine fibroids to alleviate symptoms such as heavy bleeding. Endometrial ablation. Procedure to destroy the uterine lining, often recommended for women with heavy menstrual bleeding. Hysterectomy. Removal of the uterus, considered a last resort for severe cases of menstrual irregularities. Fertility treatments. In vitro fertilization, IVF, or other fertility treatments may be necessary for women with underlying reproductive disorders. Menstrual irregularities can significantly impact a woman's quality of life. But with proper understanding and management, many women can find relief from their symptoms. By addressing the underlying causes, making lifestyle modifications, and seeking appropriate medical treatment, women can regain control over their menstrual health and overall well-being. It's essential for women experiencing menstrual irregularities to consult with a healthcare professional for personalized evaluation and treatment recommendations. With the right approach, menstrual irregularities can be effectively managed, allowing women to lead healthy and fulfilling lives.